This is Dr. Caroline Peterson and Natural Women's Health Institute. We're talking about the air body today. So when I say air body, probably everybody is thinking lungs. And that's right. That's what we're talking about. We're talking about the lungs. But we're talking about more than the lungs today because the lungs have a huge impact on many, many systems in the body. So when we think about the lungs, we're thinking about the chest cavity, right? That's where the lungs live most of the time. Then we can think about the transverse planes. So if you haven't seen my video on the transverse planes, go back and watch that. But the transverse planes that are above the lungs are the thoracic inlet and outlet here. And then we have the throat, hard palate, and then we have the sphenoid tentorium. And then below the lungs, we have the respiratory diaphragm and then the pelvic floor, the pelvic diaphragm. So when we breathe, what should be happening is that the lungs are acting as a bellows. We're getting 1 inch expansion of the rib cage, front to back, side to side, so circumferentially, not up and down. There shouldn't be any movement up and down of the rib cage. That should be held in place by the abdominal muscles. But we should have increased kind of girth of the rib cage with every single breath in. So when we breathe in, what happens is, the rib cage can only expand so much, and the lungs should be expanding more. When the lungs take in air, they will expand beyond what the rib cage can expand, that 1 inch on one side, 1 inch on the other side. And then the lungs will start to displace the transverse planes. And so that's when the respiratory diaphragm will be pushed down into the abdominal cavity by the lungs, and there'll be displacement of the organs while the core is engaged. And then the apices, there'll be some displacement up, less going up. But still, what's happening is that you're getting this vertical movement, pumping movement with every single breath. That's physiologic. That's what's supposed to be happening. And so what does that do? That is one of the big pumps for the lymphatic system. The lymphatic system needs us to participate in proper breathing in order to move it properly. And so a lot of the lymphatic stagnation I see in my practice is not because of, disease or having had resection of a lymph node or, something like that. It's that people aren't moving properly. They're not breathing properly. And so there's not adequate pumping going on in the lymphatic system. So that leads to stagnation. This is also true with the valveless venous system. So like Bateson's plexus. So in our minds, we think, the veins have valves and they help things move up against gravity. But Bateson's plexus doesn't. It's a valveless system, and it's very important, especially in pregnancy. It becomes much more important in pregnancy because there's all that extra blood. So it really expands during pregnancy. And so, especially in pregnancy, when it's so hard to breathe, we really have to breathe. We really have to move to get that Bateson's plexus and all that extra blood moving through. But it's always important to breathe, of course. So, what is proper breathing? Proper breathing is, what I call it physiologic breathing. So physiologic breathing means normal breathing, the way the body is designed to breathe. There's physiologic breathing, and then there are many, many, many different kinds of therapeutic breathing. And so people who do like yogic belly breathing, things like that, are doing a type of therapeutic breathing, which is not a bad breathing. It's a good breathing. It has its own benefits, but it is not a physiologic breathing. It's not the way that we're designed to breathe continually, right? It's not the way we're designed to get oxygen and blow off CO2. So when I see patients, I usually see patients who are not doing a bunch of apical breathing. The apices are the domes of the lungs, the upper part of the lungs. So in the olden days, when people used to have a lot of constraint, like corseting and stuff like that, tight clothing, then there was a lot of just superficial, shallow breathing in the apices of the lungs. That's, of course, not good. That leads to a lot of anxiety and a lot of other health problems, including the mechanical problems that we've kind of touched on, but we'll talk about more. But what I generally see in my practice nowadays is people trying to be good breathers and like doing the belly breathing. And so what that means to them in their yoga classes or wherever they learned it is that they don't have muscle tone in their stomach, their abdomen. And so when they breathe in, they just let the belly distend, thinking that that is helpful. Consequentially, what happens is that they don't have any movement of the rib cage where the lungs actually are. So what I always say is that, the lungs are in the chest cavity, they're not in the abdomen. And so what we need to do is to have expansion of the rib cage first, and then expansion in the abdomen is only secondary. It's only when the lungs have exceeded the ability of the rib cage to extend, to become larger, and then the respiratory diaphragm pushes down the lungs and displaces the abdominal organs so that there's enough room to get in more air. That is what is supposed to happen. So what's required for proper breathing is expansion of the rib cage, which means the lateral intercostal muscles have to open up. So usually what I see with people is the ribs are like this. And then when they try to breathe into the rib cage, they can't really do it very well because the intercostal muscles have become atrophied. So then we have to work on opening up those intercostal muscles little by little so that they can get a breath in and out. That's the way the ribs should move. The ribs should move like this with every breath. In and out. Those lateral intercostals getting longer and then closing up again. So in order for that to really happen, the core has to be engaged properly. It shouldn't be just like flaccid. Why? It's a postural muscle. It never turns off. It should always be engaged. It should always be firing, that transversus abdominis. So if the core muscles are not properly toned and engaged, then you're not really going to be able to get proper expansion of the rib cage itself. So working on toning the transversus abdominis postural muscle is a really important component to proper breathing. And in a different video, I'll go over like some tricks to get that going.